first question I have for you, so you have argued that real transformation in healthcare is just going to start with discomfort. I mean, that may not be a popular opinion, but like, what do you really mean by this?
I think the system is so dysfunctional right now. And it's because everyone's out to get theirs, right?
Yeah.
I mean, and how could they not? These are all massive organizations, massive corporations that have margins, they have revenue to hit, they have numbers to continue to increase. Yeah. And so largely, if you're focused just on those things, you're focused on the me of the equation, right? Yeah. In this case, their organization. And so you're not focused on the patient. Right. You're not focused on the member. You're not focused on the ultimate solution.
Sure.
And so what gets really hard is that before you can focus on those things, you kind of got to get right at home. And you've got to start pointing the finger at someone else and start pointing the finger at yourself and decide, am I really here to drive change, to drive good in the world? Or am I here to drive margins or revenue or whatever it is that my organization needs?
Okay, so I guess the question that follows on that is like, why do you think healthcare avoids discomfort so strongly?
I don't want to say because it's the easy way out, but it's kind of the easy way out. Okay. You know, it's what our investors want to see. Yeah. It's what my boss wants to see. Like wherever you sit in the organization, whether you're the CEO or you're an analyst just working through claims or billing or whatever side you're on, you ultimately have to decide, like, who am I trying to work for? And if that answer is my manager or my investor, that's not always the best answer, right? Yeah. And that's what we have to get to. And so at a
system level.
At a system level, the easy path is, well, I'm going to do my job the way I know it has to be done to please whoever, my manager, my investors, whoever. And ultimately, someone needs to say, I need to do my job because this is the right thing to do.
I get you.
Right? Yeah. Which is not always the easy path. In fact, quite honestly, discomfort comes from choosing the harder path, which is what we're talking about here.
You know, as I thought about this conversation coming today, one of the things that came up for me, and I'm curious what your thought is about this, healthcare, avoiding discomfort is sort of the business of healthcare. And I don't mean the business end of healthcare. I mean, it's like the function of healthcare is we're oriented around the patient and the discomfort that the patient might be in. And our focus is in the clinical, orientation, the focus is to avoid discomfort. The focus is to address discomfort. Are you comfortable, right? And you've got the smiling faces from, this is terrible, like, to I feel okay. Like, we're oriented around avoiding discomfort.
Yeah.
Yeah.
This is not what the article was about, but just think about what you said.
Yeah.
What's the easy way out there? What's the easy way to address physical discomfort?
Medication.
Yeah. The really hard way is finding the root cause of the issue.
Yeah.
Right?
Yeah.
It's changing my diet or changing my habits so that my body functions better, which solves the ultimate problem. I guess that's what we're trying to get at here.
Sure, but it's not comfortable.
Like, you can't go out and make changes today in healthcare that's really going to impact, the whole market. I mean, it's small little changes that happen in my 20 square feet, in your 20 square feet, in all of these various organizations, payers and providers, in their 20 square feet. Those small changes by doctors, by claims analysts, by everybody involved is what has to happen to ultimately have big impact on, the whole market.
Sure. So you've described payers and providers as being locked in an arm wrestling match. So what does that look like in real life? Well, how does that, I mean, if you think about it from the perspective of people who are mostly patients as they interact with the healthcare system, mostly members, how does that actually look from your side?
It's direct finger pointing. And that comes in a lot of different forms, right? It could be, the way a provider has to work a denial. Yeah. And it's not just one denial, it's a flood of denials that are coming in. So it's this constant aggravation and frustration, and not just responding once, but responding multiple times, and ultimately not getting payment. It's the frustration of payers maybe not being billed correctly and having to deny, or having to make an incorrect payment that they thought should have been paid correctly the first time. Like, it's constant small frustrations, I feel like, that build up, and then we're all human.
Yeah.
And so it's literal finger pointing. I mean, it's
Sure.
it's people saying, hey, if you did this a different way, I would not have this problem.
Right.
And when we get to that, it just gets very hard to affect, future change.
Yeah, it's almost like it's based on an assumption, a presumption of bad actors.
But maybe. I don't think it's always nefarious, but there are certainly bad actors.
It's certainly not always nefarious, but it seems to me, maybe you can correct me on this, but it seems to me that there's a perspective of bad acting. The perspective doesn't tell you what's real, it just tells you that that's the perspective.
And a lot of times that's because it's so overwhelming.
Right.
There's so many claims involved. There's so many, processes that have to occur. And so when you constantly see, you're constantly frustrated at what's happening, your first thought is always going to be, well, there's some bad actor on the other side of the table
Sure.
that's doing this to me.
Yes.
And that's now why I have to react in a similar but different way back to them.
Okay.
Right?
So you mentioned the 20 square feet thing a minute
Yeah.
ago, and that's where the change is going to start. Yeah, I think you've touched on a couple of things here, but like to the degree that you're able to, from the perspective of both people who populate the payer organizations and the provider organizations, what is that actually going to look like?
I think it's changing our mindset and getting right at home. The way Trend thinks about this is we're going to do what we say we're going to do.
Yeah.
Right? We live by that.
I get
You've
you.
heard that
Yes.
countless times at Trend.
Yeah, sure.
Yeah. I mean, and ultimately it's doing the right thing, not the easy thing. There's lots of things Trend is doing today that we're not driving the highest margins. We're not driving the highest revenue. But there are things we do because they're the right things to do.
Yeah.
Now, you got to be able to run a business and, all those things. But there are things you have to do because it's the right thing to do for your client, for the member, for the patient, whoever.
It's funny, I think about this is like just the idea of battling. Battling sounds hard, but when battling is what you're trained to do, continuing to battle is what's comfortable.
It's what's comfortable and it's completely non-productive, right? It's taking us in the wrong direction, and I think largely we've been battling for years.
Yes.
Right? Decades even. And that's why we're at a position today where like it's gonna take a lot of people changing their behavior, changing their habits, their daily habits to impact their 20 square feet so that we can have a much bigger impact on all of healthcare.
I mean, maybe you could speak to this. Why do you think it is that instinctively people feel stronger instincts on changing others before they feel instincts on changing themselves?
It gets back to that's the easier path.
Yeah.
I mean, it's much harder to look internally and say, I'm wrong. I could be doing this a different way. Because, I mean, it's going to be a hard thing to do, right? Like, it's looking internally and saying, I've got to make changes in my daily life. And ultimately, it's probably going to start with confrontation of either my leader or my investors or maybe my clients or my employees, like whoever it is. It's going to take that first confrontation to say, hey, we've got to make some changes here, right? And so I think that's why it's hard, is people internalize it and go, I'm not willing to do that. It's much easier to just put it on somebody else.
I totally get you. Okay, so what does getting it right personally look like for leaders?
I think it's having some hard conversations with the people on their teams.
Okay.
Because we all need accountability partners in life. We need people to be able to reflect back to us that you need to do the right thing, right? And what you're doing is not the right thing. And so, I think about having honest conversations with employees, people, that I look to hold me accountable, to having conversations with clients. I like to hear what clients' feedback is on this.
Sure.
Because they have an opinion to say, hey, Trend, you could be doing this in a different way, and vice versa. I mean, we will go to them and say, hey, have you thought about looking at this in a different way?
Yeah. Man, I got to imagine that just the ability to have that conversation, like, just hinges on the fulcrum of that conversation is trust. That you have established that you're an organization that is looking out for them.
It has to start with trust.
Yeah.
If you don't have trust, you can't have an honest conversation
Yeah.
where both parties are being transparent
Right.
and collaborative,
Yeah.
acting as partners. And ultimately, that's what we got to get to. You know, we're going to
Yeah.
talk about getting right and leading right, and then leaving right, and ultimately getting to leaving a legacy. You can't get to that point if you don't have transparency, collaboration, and ultimately trust and partnership with, you know, payers, providers, and the members and patients, right?
Well, of course. I mean, it seems to me like the climb for building trust between a provider and a vendor, or a payer and a vendor, is X, and the climb to build trust between two essentially warring factions that have been locked in battle for decades is X times.
Yeah.
Yeah.
Well, it's X squared, probably.
Sure, totally. Yes.
Not even times. Like,
Right.
and that's where like we get excited.
Yeah.
Because we feel like we've built a lot of trust with payers and providers.
Yeah.
And so now I feel like we're at the point where we're trying to merge the two. We're trying to get to that X squared,
Yeah.
right?
Yeah.
Where we can bring parties together to say, hey guys, let's knock down the walls and let's have an honest conversation about how we improve whatever.
Yeah.
And usually it's not we're improving healthcare, it's how do we improve our 20 square feet, or in this case, our 60 square feet,
Yes.
right?
Yes. Collectively.
Collectively.
Yeah.
And really start to drive some change.
I want to hear you tell us about the moment when you chose transparency over the safer sales pitch, so to speak. Like, when did you feel like I can make this my first foot forward and it's going to work, versus I'm going to make this the third point? Or was it always the first point for you?
Yeah, so we sat down with a client and they were asking about additional solutions, additional services that Trend could drive for them.
Yes.
And in that conversation, talking about some of the gaps they had at their own organization. And that point, that kind of fulcrum that we went over to say, hey, let's just put our cards on the table, be transparent with this client about, you know, how we're delivering those services to other clients today, even when those clients don't necessarily look like the client we were pitching to. We had a choice, right? We had a choice that we could, you know, lay out that softer sales jargon, kind of fluff up some numbers, or we could lean in.
Yeah.
And how we leaned in was talking about our experience with providers.
Okay.
You know, we leaned in by talking about how we were delivering solutions with providers, which were going to open up root cause analysis. They were going to open up, you know, additional insights with that payer client. That's not a way we have traditionally sold.
No, that would be like a room emptier.
Right. But the only reason you do that is because you have trust with the client.
I get it.
Right? I mean, we know that our clients trust Trend, but there's a certain level of trust you have to have with your client in knowing that, hey, they're going to accept that and then give feedback. And in this case, they were blown away and you know, paid it back in spades, if you will,
Yeah.
by appreciating the transparency,
Wow.
by appreciating the honesty,
Yeah.
and having a discussion about why that is important.
Yeah.
You know, why that provider viewpoint, that provider trust is important in trying to deliver, you know, additional solutions for them as the payer.
Transformative moment.
It
Oh,
was a
actually, maybe not.
transformative. It wasn't a small scale. For
Sure.
me personally, it was. And I would say, you know, we have more and more of those discussions with both payers and providers. You know, the same is true on the provider side. You know, our solutions that we're delivering to providers are important. They're insightful because of our experience on the payer side,
Sure.
right?
Yes.
And so that's where all this is kind of coming together for Trend in a way that it hasn't in the past at this scale.
Yeah. Man, it's so, I don't know if it's ironic or what it is, but this idea of transparency, of data sharing has been like, we know this is the problem. We know this is the problem.
Yeah.
But doing it like direct between these sort of opposing forces is like, it's a non-starter. And that Trend is able to sort of provide a pathway to actually getting that done is now finally unlocking a known potential that just felt unattainable.
There's just not enough trust for it to happen directly, right? And so it's got to go through, in this case, Trend, as a vendor
Yeah.
because there's trust of how we're going to ingest the data
Yes.
and then what we're going to do with the data.
Yeah.
And ultimately, it's to further both sides.
Right.
But that's a difficult concept to get to. I mean, I feel like as a vendor that we're kind of inching forward in our 20 square feet, or in this case, our collective 60 square feet.
Yeah.
If the two would just be transparent and collaborative together, if there was trust, that's how we would make leaps and bounds in improvement.
Right. Well, this is the difference in perceiving information exchange as espionage versus seeing it as the pathway to accuracy, because that is what all I've ever really seen Trend do with any information it's received is to ensure greater and greater degrees of accuracy.
That's right. That's right.
Okay, so after we get right, you talk about living right. What's the difference?
So getting right is instituting those small daily habits to positively impact your 20 square feet. Okay. It's doing the right thing over and over and over. I think living right is the practice of like rolling that out to your team at Trend, or rolling that out to your organization, right? And so we talked about one of the things you hear at Trend all the time is we do what we say we're going to do. Mm-hmm. We are constantly looking to do the right thing. That has gone throughout our entire organization at this point. And so now you don't just have leaders thinking that way and acting in that way. You've got our management team, you've got our analysts that are actually working claims. Yeah. They're living that way. I mean, that's the culture that you're building. And so getting right is the practice of like developing the habits. Yes. Living right is putting them out into the world, right? It's actually living in that way.
Yeah, it really sounds like this kind of a chain between actions. You can get right with a handful of actions.
That's right.
There's behaviors which inform your actions, right? So the behaviors of the processes of getting right, and then mentality is the kind of the top of that pyramid, where your mentality is oriented around continuing to undertake behaviors that result in the actions that consistently have you getting right across not just one function, but living right is sort of a multidimensional.
It's how your take on the world, right? It's how you're impacting the world because you're doing all these small things that you've now built up, these small behaviors that you've put in place.
Yeah, tiny habits.
Tiny habits.
Okay, what changes when leaders focus on purpose instead of politics?
I mean, it gets back to everything we've been talking about,
sure.
Right? It gets back to transparency and collaboration. Like when those things happen, when you're dedicated to a purpose,
yes,
it's because you've put these various daily habits into place. You're starting to impact others, right? We talked early on about I've got to get right myself, then I have to live right before I can ultimately lead right. And so this is about a focus on purposefulness. And a focus on impacting others kind of outside of myself, or in this case, outside of Trend.
Yeah, and it does also seem like you can exhaust the potential of politics, but purpose is not constrained to any modality. Politics is a modality, but there's so much more, and all the things you've been laying out just kind of fill in the picture of what more there is. And being oriented around purpose sort of frees you from the constraint of any specific modality.
Well, and it gets rid of all of the other reasons that you might take the easy path.
Sure. Yeah. Yeah.
Right. Living with purpose carries you to almost a higher purpose. It's the wrong way to say that, but it carries you to do the right thing on a consistent basis, rather than focusing on these metrics over here that were maybe just leading us down the wrong path.
And there really is. I'm seeing this as you lay this out. I'm really seeing such a difference between the idea of a job and a legacy. I mean, like having a job, you show up and you can do a great job at your job, but having a legacy is a totally different mindset.
Well, just having a purpose is a different mindset, much less a legacy.
Right.
Right. Just having a purpose means I'm going to go out and change the way I'm impacting others.
Yeah. Okay.
Right. And whatever that purpose is.
Okay, so maybe we can kind of take it now to the perspective of healthcare leadership specifically. What does embracing discomfort look like for healthcare leadership?
I think it's got to get back to looking at how they're impacting their line of work and not taking the easy way out. They've got to make changes, and it's got to start with healthcare leaders. There's no doubt about that, because it's got to start with those folks getting right, leading with purpose, through transparency, through collaboration, so that they can start to change the culture of their teams.
Yeah.
Right? I mean, we started this whole conversation about, finger pointing, kind of the arms race, all this dysfunction in healthcare.
Yeah.
I mean, that's because we have changed the culture of healthcare over decades. So healthcare leaders are now going to have to make a pretty drastic change over time to impact their organizations, which is not going to be easy.
It's not. Do you know what I'm hearing from you? It's like, all these organizations have a purpose, right? Whether they're the health systems or the payer systems,
Yeah.
the vendors, they all have their own purpose. I think what you're asking for is a higher ambition, a purpose that goes beyond the individual organization to the system that we're all a part of, to have an elevation of what's possible that goes beyond my role and my company.
And it's got to trickle down.
Yeah.
We work with leaders every day, with payers and providers who are doing this in their own 20 square feet. But they're one leader at a large organization. It does take a culture shift,
Yes.
right? It's more than just one director in payment integrity or one, manager in rev cycle to make these changes. There's a lot of people, and I'm lucky enough in client success that I get to see these people's hearts. I get to see them be vulnerable about the way they care for their patients and members. But it takes a much grander change across their organization for us to all have, real impact. Okay,
well then let's bring it down to the purpose that we've been talking about. Why is collaboration harder than competition?
It really gets back to how we started this conversation. Because it's not the easy thing to do. Competition's the easy thing to do, right?
Man, I know why you're saying it, and I totally agree with you, but I just imagine leaders on both sides thinking right now, you think this is easy?
Well, not easy in the fact that my job is easy.
Right, yes.
But it is easier to confront somebody else about your frustrations than it is to collaborate them when you're frustrated.
Yes.
Collaborate with them when you're frustrated, right? Think about that. Someone on the other side is confronting you about maybe an action that you're doing to them, maybe not, maybe it's just a misperception.
It's just your process.
Either way, they're confronting you. You're immediately defensive.
Yes, yeah.
And what we're asking is for you to stop and take an open-minded approach to what they're saying.
Yeah.
That's collaboration, right? Collaboration is listening to somebody else, digesting their feedback, and then responding with love, with a good intent to improve the process.
Yeah.
And that's just really hard. I'm not saying that everyone's job in healthcare is not really hard right now, because there's a lot of pressure out there. That's not at all what I'm saying. I'm saying the hard path is through collaboration.
Yeah, and it does feel like, I'm not quite sure which saying it is, but many sayings that have talked about what you find in terms of a person's character, in terms of their capacity of leadership, is when things are very hard.
When things break down.
Yeah. Okay, so you ask a tough question. Are you a part of the problem or a part of the solution? How should leaders think about that? How can you know?
I think people have to take that back internally. They have to reflect on that personally. And that's what I would ask of all the leaders, of people watching this, short clip. Reflect.
Yeah.
Reflect yourself, and maybe grab an accountability partner. Maybe it's a vendor. Maybe it's if you're a vendor, maybe it's your payer client or your provider client. Maybe it's a leader at your organization, or maybe it's an analyst on your team. But find somebody and reflect on that question. Am I bettering the problem, or am I part of the problem?
Yeah, I think it's critical that they would have enough of an elevation of what the problem actually is before they can respond to that. But I get where you're coming from.
Yeah, maybe. I think in a lot of cases we all know. We know when we're a part of the problem or when we're helping to fix a problem, right?
Okay, so as a last question, What legacy do you hope healthcare leaders choose to leave?
One of doing the right thing. I mean, ultimately, we are all, whether we want to be or not, we're all in this together, right? And I'm not saying that as an SVP of client success for Trend Health Partners. I'm just saying that as a patient member myself.
Right.
We're all in this problem of, healthcare costs skyrocketing. We're constantly seeing the war that's out there between payers and providers. We're all in this.
Yeah.
And so I ask for the state of U.S. healthcare.
Yeah.
For my own kids.
Sure.
Like, let's change.
Yeah.
It's got to start small, and it's got to start with us.
I get you.